I'm going to demonstrate the difference between an indwelling catheter and a straight or intermittent catheter so that you can see the true differences between the two tubes. First, we have the intermittent catheterization tube. This is a straight tube that has a couple of small holes at the top to drain urine. What you would do is follow your normal sterile technique procedure, which you will see in a minute, lubricate the tube, and gently slide it into the urethra, into the bladder. The holes at the top of the tube will allow urine to go into the tube, and urine will come out the bottom here. You can drain this directly into a drainage bag, depending upon your facility, into a urinal, or into a specimen cup. After holding it in place for roughly 5 to 10 minutes, allowing the bladder to completely decompress and drain, you will just gently slide the catheter back out and dispose of it properly. Now, that's the straight catheter or the intermittent catheter. The indwelling catheter is the catheter you want to leave in for a longer period of time, a couple of days, a few weeks, whatever the patient needs. It looks the same. The only difference is it has 2 ports at the end, not 1. This will be the same. Urine will come right back out of it after going through the holes at the tip, coming down the tube and out. And we will hook it up either to a leg bag for the patient, a larger collection bag that you would hang on the side of the bed, or to a specimen container. The second port is what we use to inflate a balloon so that it stays securely in the bladder. So once again, after you have followed your sterile technique, you've lubricated the end of the tube so it'll gently slide into the urethra, you've put it into the urethra, up into the bladder, and the holes at the tip will give you a positive sign that you're in the bladder and you're in the right spot, and urine will start flowing out of the tube. You continue to insert all the way up to the Y so you know you're securely in the bladder, and then you gently inflate the balloon by pushing on the syringe. As you can see, the balloon is clearly inflating. You want to put all of the saline or sterile water into the balloon, and now you let the tube slide back. This will rest against the bottom of the bladder, called the bladder outlet, right where it connects to the urethra, and this will continue to float right in the bladder, draining urine as it is made. When the patient is done with the tube and no longer needs this catheter, you would insert any syringe, making sure to take out all of the fluid in the balloon until it is completely deflated, and then the tube will gently slide out, and you will discard of it appropriately. I hope that clears up the difference between the indwelling and the intermittent catheters. We'll get a chance to look at both of these in class.